Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, you'll be able to help support our community here at DamiRx Care. So what is our medication of choice today? Our medication of choice is Solifenacin succinate, which is also known as Vesicare. So what is Solifenacin used for? So Solifenacin is used for patients who have urinary incontinence or patients who have an overactive bladder. So this medication can be effective in those patients in order to be able to help them pass out urine. And this medication comes usually in a 5 milligram tablet, and patients are usually on a 5 milligram tablet once a day, and it may go up to 10 milligram depending on how well the patient is tolerating the medication or how effective the 5 milligram is. So this comes in a tablet, and what are those side effects to look out for while taking this medication? So side effects include dry mouth. This medication can also cause dry eyes. It can cause drowsiness. It can cause constipation. It can also cause dizziness. It may cause UTI in some patients. It may also cause indigestion. So just in case if those start happening, you're making sure that you're reaching out to your doctor. It can cause fatigue in some patients as well as blurred vision. It can cause constipation as well as abdominal pain. So those are common side effects. And like I said, always say side effects are not an all-inclusive symptom. So if you start feeling them and it becomes consistent, then you want to make sure that you're reaching out to your doctor. If it's a serious side effect, you want to make sure that you're reaching out to them as soon as possible. Or if it's an emergency side effect that you're getting, making sure that you're seeking urgent care immediately. All right, so what are some serious side effects of this medication that you need to reach out to the doctor for urgently or as an emergency help? So serious side effects include agitation. If you start feeling agitated or you start feeling confused after taking the medication, if you start having some blurred vision that's consistent, or consistent headache or hallucinations while you're on the medication, or consistent drowsiness, then you want to make sure that you're reporting to your doctor. That way they can see if there's a substitute that they can switch the medication out for. I believe there are plenty of substitutes that the patient can use in patients that have the overactive bladder or urinary incontinence. So just making sure that you're reaching out to the doctor. That way they can switch this medication as appropriately. All right, so who are the people that cannot be on this medication? So if you have like a primary condition of urinary retention or like a stomach retention, this is not a medication of choice for you. So you don't want to take this medication if you have an underlying issue that hasn't been treated. It would just be like, not effective for you in those patients. Also in patients who have a narrow angle glaucoma, this medication may worsen that condition, so you don't want to take it in that patient. Also patients who have an issue whereby they have a decreased stomach movement, these patients don't want to use this medication because it's going to worsen that condition. So what are things to look out for? Like I said, regarding the side effect, this medication can cause drowsiness or dizziness. So if you are going to do something that requires you to be mentally alert, make sure that you're well aware of how well you tolerate this medication before you do those. If it's your first time or you're just starting to take the medication, make sure you avoid any, activity that requires for you to be mentally alert while you're on this medication. Also, this medication may be taken with or without food. So feel free to take it with food while you're taking the medication. Also, this medication should not be chewed, divided. It shouldn't be crushed. So make sure that you're taking the whole tablet when you do take the medication. Like I said, this medication can cause dry mouth, blurred vision, or constipation. So if you start feeling those side effects, make sure that you're reaching out to your doctor immediately. And Also, on this medication, you don't want to be in the sun for a long period of time, as this medication can increase your sensitivity to the sun. So if you are going to go out for a longer period of time, you want to make sure that you're applying your sunscreen, making sure that you're staying well hydrated, and also taking those photosensitivity precautions when you do go out. So this medication may get into the breast milk for patients who are nursing, so make sure that you're aware of that, and you want to make sure that you're using caution when you're breastfeeding as you're on this medication. So I hope I was able to help in terms of what to look out for while taking the medication. If you have any questions, feel free to leave comments below, or you can check out our website at www.demyrxcare.com in order to consult with a pharmacist there. Thank you for watching and stay blessed.